Every person I see reminds me of me. Any of them could have been me. It was me. And I don't think there's any reason for anyone to be turned away for any kind of medical care.
Today was a typical morning for me, and I saw patients speaking English, patients speaking Spanish, Somali, Arabic, Vietnamese, and Burmese. Those were my patients this morning.
And that is where I make my greatest impact, because I'm able to prevent illness. And that's what this is all about, preventive medicine.
I don't care what kind of insurance you have or whether you don't have, you're going to get the best care here. So if you don't have insurance now, when you get insurance, you still come see us.
I believe it's something we can share together, standing tall against the storm. They're telling me the times that
While others are talking about healthcare and how to improve access to services, our community health centers have been doing it and have been doing it for 40 years.
I
am very alive and well, and it's all due to the community health center. And if it wasn't for them, I probably wouldn't be alive right now.
Sometimes I get a lot of phone calls. Are you diabetic? Well, we want to take care of you. I said, no, you don't have to. I got people that are doing that already.
It's a place where you're going to get excellent care by people who do care.
My community health center has been crucial to giving me a healthy body. I can use my pretty good mind and my loving God spirit to help others. Now, what more do you need for the good life?
America's Community Health Centers. This is our story. In the early 1960s, our nation was awakened to the reality of millions of Americans living in poverty, uninsured, with no access to medical attention.
And at that time, we knew there were people, mostly older, who made the choice between food or medicine. And that was in the real world.
Kids, we were driving them to get their teeth extracted, permanent teeth, and so children who were compromising the whole future because they didn't have basic health care in our area.
And his response to me was that he just needed someplace to go. And everybody just needs someplace to go. And that's what we need to be.
Pioneer servants of the community, doctors, nurses, community leaders, volunteers, all began to take a stand and address this growing healthcare epidemic.
Well, the health center movement really started in the 60s, and I like to think of it as an experiment that really worked.
The year was 1965, and in Mound Bayou, Mississippi, and the Columbia Point neighborhood in Boston, Doctors Jack Geiger and Count Gibson pushed forward a radical new idea. It would change the course of healthcare delivery, a community-based model of healthcare that was to serve all people, regardless of their ability to pay, and give patients a voice in how that care was delivered.
Someone had to do it. Someone had to become a community health center. We'd do whatever it took in order to get one started.
So we had a dream. We had a dream, and it definitely was a case of if you build it, they will come.
And about the same time, we realized that out there was a community health center movement going on in the United States. And that arrangement seemed perfect because it allowed a clinic to take care of Medicaid patients as well as uninsured patients. Plus, you could include your own insured patients if you wanted to.
Obviously, I knew nothing about running nothing. I knew how to be a nurse and I knew how to be compassionate with people and understand their needs, but so I was learning as I took this job.
Pretty much by volunteers, volunteer doctors and nurses. So we didn't have any resources. We didn't have any budget. We didn't have any supplies. We didn't have any equipment. So one of our volunteers, who was a very bright college student, decided that he was going to build his own medical equipment. So he went out and bought some spare parts, and he built a centrifuge.
Equipment was old and had been retrieved from charitable donations of some kind or another. Jack used to say that the X-ray equipment came off the Mayflower. It was pretty old, but it worked. A copy machine was a big deal back then, you know.
Really, I was living out of my checkbook, and so the first person I really needed to hire was a finance person, so I could get some money back in return. So.
Back during the old days, I had to literally write the grants, write the progress reports, and sometimes see that the billings went out on time. And a couple of times had to even close the books.
I don't know where we're going to get $70,000. What do you think we should do? So I said, simple. You and I are going to write a check for $1,000, and all we got to do is find 69 more people to do the same. So he said, okay, you're in charge.
And I said, I need your shop, and I have some cold cash. I'd like to buy your building. And he looked at me like, what? Where are you coming from?
Since then, community health centers have delivered basic health care services to thousands of communities in need. They have evolved into a vital safety net for the uninsured and vulnerable.
So, for example, at Family Care Health Center, patients can come here. They can see me for their primary care. And right on staff in the same facility, we have a lactation consultant, we have a nutritionist, we have a dentist, we have our own pharmacy, we have a psychiatrist, and the list goes on in terms of support services that I can draw on in order to take care of my patients' needs.
Community health centers today do much more than basic primary care. Through the years, we have developed expertise in identifying and treating chronic conditions.
Today, if you look at our facilities, they're state-of-the-art. They're digital x-rays. We're paperless. We have all the technologies that you'll find in private practice, and sometimes even better technologies.
Our clinics and our physicians are so in tune with making sure that their patients have something that they can afford, something that they can live out the rest of their life, being able to take care of themselves. I love it when I get somebody who comes in, they're paying a lot of money for a brand-only prescription drug, and we can save them so much money. They say, hey, I can't believe you guys can beat Walmart's price.
So not only is it the healthcare arena, the dental care, is also the investment back into the community of the jobs that we bring into the community and the lives that we touch within the community.
Quality healthcare too. High quality healthcare for all. Because the healthcare delivery that I provide is no different from 110 West 97th Street and Park Avenue. It's the same thing.
I feel very fortunate that it was a very unique opportunity to both see patients and kind of get that one-on-one interaction with patients, and yet also work on a level where I'm looking at the population, also looking at a very unique disease, hepatitis B, that's very common in Asians.
And I can't tell you how appreciative that mother is when she comes in and says, this is the difference between my child succeeding in school or being in the disciplinarian's office. It's that big of an impact.
We've got second and now third generations of families that are still coming to our institution to receive our services, which is a very warm feeling. I mean, we are the resource that they depend on to make it to the next day.
If we weren't here, I don't know where those people would go. I really don't. I think it would be difficult.
I think we're finally making a dent in the population of kids who have never seen a dentist.
And it really is a movement. It came out of the civil rights, and that became very meaningful across the country with bipartisan support.
We're not out there competing to steal patients from one another. We're out there to compete for those patients, to get them in the door that otherwise just would go without health care. It's getting them off the street, motivated and kind of engaged in their own health care.
There's a lot of physicians who are willing to take care of people that have money, and some of us need to take care of folks that don't have money, and so that's my job.
Today, community health centers are located in all 50 United States, U.S. territories, and the nation's capital. And with 8,000 locations, they are serving over 20 million people. But the demand for health care is at an all-time high.
Unfortunately, there's some areas that have third world conditions, and so we are severely lacking, and we have a lot of need.
Southern Jersey sees so many migrant farm workers who would have no other place to go.
To answer this need, community health centers have launched a plan called Access for All America. This plan will expand health centers into more communities to serve over 30 million people by the year 2015.
It's well documented from government studies and private studies that community health centers are more cost effective and provide higher quality care than some of our comparable sisters and brothers in hospitals and private practices.
So we know what's going on. We know what people need, and it's easier for us to get the things done if we, smart enough, bright enough to set up a system like this.
And there's interest by, of course, the federal authorities, by Congress, by the president, because they know that these health centers, we work. It works. I mean, we work for the community, we work with the community, and we have good outcomes. We save money. We just know how to do it.
There's just too many good doctors here. I think these are the best doctors in Springfield. I really do.
Call it Revenge of the Nerds, call it the ugly duckling becoming a beautiful swan, but ambulatory care medicine is really where it's at these days.
Medical home means that we're kind of a family when we take care of our patients, and that's how we want them to think of us.
Because not only do we tap into the normal mainstream community, we touch the unreachables or the inaccessible or the people who think that, just because they're homeless, they have no quote-unquote right to care. And when you give them that access, you give them power. And once you give them power, you help them with the situation, which is what community health centers are about in the first place.
Our future, our children, and if they can start brushing their teeth and you can educate parents, then they can have a mouth with no cavities for the rest of their life if they're, if they're properly educated.
So I really think that the next generation, the next moves for these community health centers is going to be in a way that takes that great foundation of top-notch medicine that the clinicians brought to community health centers. It's going to marry that with technology and consolidated information, and it's going to create an explosion of efficiency in the community health center movement.
I believe in the mission.
I believe what we're doing is right.
That the seeds that we plant each and every day in a community health center with our patients, with our staff, will at some point bear fruit for someone.
America's community health centers provide comprehensive primary and preventive care to all, regardless of income or insurance status.
Now I'm on the other side of the fence, and we do have insurance, and it's the same. I mean, no one knows, no one treats you any differently. You come, they just ask for your card, they put it in, and that is simply that.
Countless numbers of studies show that America's community health centers provide cost-effective, quality care, save lives, keep people out of emergency rooms, and save millions of dollars for American taxpayers and the nation's healthcare system. America's community health centers are locally owned and controlled by their communities through consumer majority boards of directors. They train doctors, nurses, dentists, and other healthcare workers needed now and into the future. They continue to have long-standing bipartisan support by Congress, state lawmakers, corporate America, and the small business community. They provide thousands of jobs across the country for community residents. And today, America's community health centers are being called upon by the nation to lead the way in primary care into the future.
You know, it is imperative that we continue to advocate for these agencies that are providing outstanding services and care to the folks, as I said earlier, that need it most.
When we talk about gatekeepers, community health should be leading the charge to be those kind of clinics.
I am very alive and well, and it's all due to the community health center. And if it wasn't for them, I probably wouldn't be alive right now.